Thank you very much for participating in our first webinar of 2021 in the Global Fund's ongoing series, Reports from the Frontline. We are very honored to have such a large and distinguished audience today, no doubt owing to our topic and to our leaders who have agreed to report to us today. This audience includes many ambassadors of the order and their diplomatic team, many presidents and hospitallers of national associations, heads of our relief organizations, our envoys to the Global Fund, very generous donors to the work around the world. There are many members of the government of the order, including the Sovereign Council, the Government Council, the Camera di Conti, as well as their dedicated staff at the Grand Magistracy. So welcome one and all, and as I peruse the list, I am overwhelmed by the expression of interest from Brazil and Philippines and some guests who are joining us for the first time. So warmest welcome. And through the end of the year, we've been covering the remarkable response of our order to the global pandemic. And today we're going to be speaking specifically about how the diplomatic channel is being deployed. Our order continues to increase its worldwide engagement. Many of our socio-medical projects have been scaled up or converted to programs aimed at preventing or treating COVID patients in all of the 120 countries where our order operates, either an association, a relief corps, a volunteer corps, or an embassy. The medical and logistics assistance is being provided to national health systems. New hospital wards for COVID patients have been opened, and existing hospitals run by the order have been converted into ICU units. In countries where basic hygiene conditions are precarious, awareness campaigns have been implemented. And in others where strict regulations and countries where lockdowns underway, some activities of the order providing social assistance have had to be reduced, but then more have been strengthened in particular to address some of the great economic difficulties that many people are facing. In other countries where volunteers of the order have been able to ensure delivery of food and basic items on a regular basis, as well as offering medical assistance. And many of those efforts are supported by the order's embassies as they manage to continue their routine home visits and ensuring medical assistance, where in some cases there's no other option besides the work the order's doing. And in particular, I think in a particular way that expresses our charism, the Order of Malta has also deployed a professional group to tackle psychological effects of this imposed quarantine, where people are isolated and emotional distress has been caused, psychological disorders, starting from depression and moving into much more serious situations. And finally, our order's diplomatic network is also fully engaged, and this is our topic today. We are honored to have with us our Grand Chancellor, Albrecht von Boeselager, who has the overall responsibility for both our diplomatic channel as well as the national associations carrying out the work throughout the world. He is joined by Ambassador Stefano Ronca, who is the Chief of Foreign Affairs and serves as our ambassador to Italy. He has been ambassador of Italy to Bucharest and Buenos Aires. He's been the director for multilateral political cooperation and human rights, and is the recently retired chief of diplomatic protocol for the Italian Republic. He's now the diplomatic advisor to the Grand Chancellor, and is, as I say, our ambassador to Italy. We're also joined by Ambassador Zanardi Landi, Antonio Zanardi Landi. He has also a remarkable career, having served in the Italian cabinet for the foreign minister, as well as many diplomatic posts, including Tehran and London. And he has served as Italy's ambassador to Serbia and Russia, and to the Holy See. And since 2016, he has been the ambassador of our order to the Holy See. So I'm sure I've missed out a number of other remarkable positions, but do forgive me. I do want to jump into today's conversation, where we will endeavor to share what the impact looks like when it's aggregated, the impact of the order's diplomatic channels when it's aggregated and applied as a voice of those we serve through this channel. So with no further ado, I will invite the Grand Chancellor to talk to us a little bit about this very current issue of access to vaccine. It's become obviously a very hot political topic. I know you spoke recently of both the health concerns that can pose if the vaccine is not controlled and distributed globally, but also the ethical questions it raises about the disparity between rich and poor. Can you share some thoughts with us, Grand Chancellor?
Thank you, Lisa. I think in general, this is a very easy question. In practical, it becomes very difficult. I think it's easy insofar one can say that as long as the virus, we don't get control of the virus at any spot of the world, we will have a problem. As long as there are hotspots, there will be new variants, new mutations, and the problem will not be solved, with effects on everything, on traveling, on business, and of course, on people. So it's an objective interest, or should be, that vaccines are distributed everywhere as soon as possible. Otherwise, the medical problem will not get under control. And of course, this also has an ethical aspect. As the Holy Father pointed out several times, it's not acceptable that all the vaccines are reserved for the rich part of the world and the poor part is left out. So, but these two statements are easy to say, but it's not so easy to put it into practice and to find the correct and best way. If the rich countries would not have been ordered such high quantities of vaccines, the medical industry would not have been able to set up production lines as they did in recent months. So we have to differentiate a bit. And then there are different types of vaccines, as you all know. Only so far the vector vaccines are vaccines which are easy to handle. So Johnson & Johnson, for instance, and AstraZeneca, which can be used in countries with a less sophisticated infrastructure than developed countries, where cooling lines have to be observed and so on. Anyway, for the moment, there are not enough vaccines. And even in the rich country, in most of the rich countries, only a small minority of people have had access to vaccination. So the practical issue of distribution, I think, will arise in the second half of the year. And one point I think we should insist on is most of the developed countries here have ordered much more vaccines than necessary, because when they ordered the vaccines, they didn't know which company would be able to get ready. And so they have ordered at many companies, different companies, quantities which altogether go far beyond the need. So the question is how these vaccines, which will be available at the end of the year, can be distributed to poorer parts of the world before they lose validity. I think the COVAX initiative launched by the World Health Organization is a well thought through initiative. They have established a good mechanism of negotiating prices and buying vaccines, but they are still lacking a lot of money. So we have to insist that the rich countries also, as I said, in their own interest, provide more financial resources to this international initiative so that vaccines can be distributed better around the globe.
On that point, the order has called for migrants to be included in the vaccination programs. Can you tell us a little bit more about how that might work?
There has been, let's say, one case in Colombia where at first it was announced that the migrants would be excluded from vaccination, which then led to some statements also from the Holy Father, and Colombia has changed the policy. As I said before, it cannot be in the interest of the hosting country to leave groups out, because then you will not control the problem in the country. For instance, in Europe, especially in Eastern and Southeastern Europe, we will have a challenge to get the vaccines to the gypsies, which have a very low vaccination rate anyway, or with other vaccinations. And so we are faced with two different kinds of challenges: sufficient amount of vaccines, but also convince minorities in the population to accept vaccination. So there's not one golden bullet. We will have a lot of different problems to solve in different regions. In the poorer part of the world, some have an astonishingly good prepared infrastructure for vaccination, especially countries, for instance, some of the countries where infectious diseases have been very frequent. Some countries of Africa, I think, are quite well prepared for vaccination campaigns. Others, where we have ongoing conflicts like Sudan, Syria, and other parts of the world, even the normal healthcare has broken down totally. So nobody can imagine how it will be possible to get vaccines there and people vaccinated. So it's a very differentiated way.
Yeah. Before we carry on to talking about doctors to doctors, which I know you and Ambassador Ronca are working very closely on together with doctors and medics from around the world. I just wanted to ask you one more question about just the increasing need in so many countries where the order is active, including for the basics such as food. Where do you see the priorities of the order's work going forward?
It again depends on the part of the world we are speaking about. In Africa, especially as long vaccines are not available in greater quantity, the focus clearly is on basic healthcare. The World Food Organization estimates that hunger will increase by 40% this year. So in Africa, more people die of hunger and traditional diseases than from COVID. So, and this gets a bit out of the general attention. Yeah. So the challenge is to keep up and even scale up the projects to fight hunger and other diseases.
Thank you very much. I'd like to now ask Ambassador Stefano Ronca to join you in this this conversation. And I hope most of you have heard of the Doctors to Doctors initiative that has united medics around the world in sharing knowledge. And I will leave it to the Grand Chancellor and Stefano to elaborate and talk a little bit about the Order's diplomatic network support of this and how you see this developing over the year. Stefano?
Thank you very much, Lisa. I will try to give you a picture on the project Doctors to Doctors, as well as some other projects which are carried on by the Foreign Department from the Grand Magistracy. There is no doubt that most of the order energy over the last 12 months have been absorbed by the pandemic. This initiative, Doctor to Doctor, is rather significant. We started it last March, together with the Grand Hospitalet Office, and for some of the sessions with the British think tank called Forward Thinking, especially for the Middle East, to organize a digital platform of experts, medical doctors, politicians and administrators from many countries in various parts of the world, Middle East, Africa, and Latin America. The aim is to share knowledge and promote better understanding of best practices in coronavirus prevention and therapeutical strategies. By sharing best practices, the hope is to strengthen national responses to save lives. So far, almost 200 experts from 25 different countries have participated in English and in Spanish, depending on the country concerned, but the platform involves not only doctors, as I said, since social, economic, and political issues are discussed. Politicians, policy makers, administrators, and diplomats also take part. To give just a few examples, in areas such as Gaza, Yemen, Lebanon, or Ukraine, the pandemic has implications that go well beyond the medical aspects. The last country we dealt with was Ukraine, where the pandemic has had a serious impact on humanitarian action in general and on the protection of human rights, particularly freedom of movement. In the east of the country, the impact has been very severe, and people affected by several years of conflict often lack the capacity to cope with additional hardship, as you can imagine. The pandemic does not affect fragile communities as migrants and refugees the same way in countries where medical and social infrastructures are solid and efficient. What emerges from our webinars is that the pandemic has multiple effects on many levels, because this is a transnational threat that no state can hope to defeat alone. The virus calls out for a multilateral approach, and despite political tensions, regional policy makers sometimes recognize that sharing best medical practices is critical to contain and treating COVID-19. The scientific merit of the Doctors to Doctors project is expressed by the concept of sharing medical and health practices to combat COVID-19 in keeping with the Order's principles followed up and continued support and exchanges after the webinars. Doctors to Doctors proved to be a successful way to develop capacity with practically no need of financial resources, because it is based on lessons learned, best practices, personal experience, and above all, goodwill. the informal verbal exchange proved to be successful also because the many spontaneous questions and doubts were expressed freely without the usual filters, including psychological ones, usually imposed by a formal symposium or a written presentation. Beyond the purely medical discussions, there was much emphasis on efficient communication policy. Communication is essential to contain the spread of the virus and should be better coordinated in each country and among countries. The experience of Ebola in Africa, which you probably know, by the way, is spreading again, highlights the importance of developing communication strategies in consultation with local leaders and religious authorities who can disseminate key messages even during prayer services. Authorities, moreover, should be aware of the risk of misinformation and conspiracy theories, which erode trust. This concerns preventive measures, therapies, and vaccine. An added value for the order in this exercise worth mentioning is also the enhancement of diplomatic relations the Order of Malta enjoys with so many countries. More than 15 workshops have been organized with professionals from countries all over the world. The next one on Thursday will be with a group of Middle East countries focused on vaccines. Now, the general view shared by the participants is that the onset of the pandemic was predictable. The Grand Chancellor and I were present in the 2017 Munich Security Conference when Bill Gates warned the participants of the imminent arrival of a pandemic. There had been numerous epidemics in the last years. The dangers was well known and acknowledged. That so many countries were nonetheless so ill prepared for the arrival of COVID-19 clearly shows the need to bolster public health. Unfortunately, the lack of cohesion that the world needed to show during the pandemic, the worst crisis after World War II, was not reassuring at all. The "my country first" attitude continued to prevail, while the message should have been no one is safe until everybody is safe. This message would not only satisfy an ethical imperative, as the Grand Chancellor has before highlighted, but would also be the most coherent from a scientific point of view. The COVID pandemic is an uneven pandemic affecting different countries and societies in different ways, as the Director General of the WHO, Tedros Adhanom, explained. The best way to fight the pandemic and prevent the virus from developing new mutants is with massive donations of vaccines around the world. Now, it is very sad to observe that if a feeble impulse to disseminate the vaccine in Africa exists today, the main reason is not humanitarian, but is explained by the rivalry between China, Russia, and the West to affirm and consolidate their power. Antonio Guterres, the Secretary General of the UN, said that the two most relevant global challenges discussed at the Munich Security Conference this year were COVID-19 and climate change. There is no doubt that both can be defined as security issues and threat multipliers. Far greater sincere cooperation and coordination between states is needed in the field of health if similar pandemics are not to devastate the world again. The shared conclusions of the participant of our frequent doctor-to-doctors meeting is that health should not be seen as a cost, but as an investment in the security of a country. Now, Lisa, if you allow me, I would like to remind to all our friends that besides the COVID-19, several other projects are going on in the diplomatic service and the Grand Majesty Foreign Department. Migration, first of all.
Yeah. Thank you, Stefano.
Migration remains a priority for the Order of Malta. People continue to die at sea. And this is the reason why the Grand Chancellor in September signed an international agreement with the Italian government to institutionalize the presence of doctors and paramedics of the order on board of the Italian Coast Guard vessels. And last week, we offered a course on human rights for members of the Libyan administration that we consider the most significant effort in the field of migration. We collaborated with the Institute of create a course for 20 high-ranking Libyan officials representing the Ministry of Interior, Defense, Labor, House of Representatives, and Coast Guard. The course was inaugurated by the Grand Chancellor himself, and this happened last Monday. The G20 on religions is another very big project for the order. The G20 ministerial meeting this year will take place under the Italian presidency, and Cardinal Zuppi and Professor Meloni, an Italian historian, will coordinate the G20 of religions. We are in contact with the Prime Minister's office in Rome to see how we can participate and contribute. And the day after tomorrow, Professor Meloni will meet the Grand Chancellor to discuss the form and substance of the order participation. In fact, in this context, our plan is to present a compact on religions in action, the sort of guideline prepared on initiative of the order by religious experts of Christianity and Islam, obviously open to other religions, to assist religious leaders and local communities to de-escalate tensions in certain areas. Artificial intelligence and digital divide, of course, is another area of interest for the order. The order recently appointed a special envoy on this matter to deal with the new exclusions posed by the new technologies. Many jobs will disappear or will be completely transformed in the next few decades as a consequence of the new technology and artificial intelligence. The poor, most elderly and fragile people will pay the consequences of this evolution that will be beneficial for some, no doubt, but very negative for others. Let me conclude with only one other project. There are several others, but I will stop there. The Alliance for Religious Freedom, which is a group of 32 countries set up at the margins of the United Nations by a US initiative, where we were invited to join and speak as the only institutions among states. This was for us the added value of the exercise. And it will be most interesting to observe how this group will evolve under the Biden administration. It is likely that religious freedom will stay as a core issue, but will be probably complemented by other goals. Much will also depend on the chairman, who will replace Ambassador Brownback. I thank you very much, Lisa. I just wanted to mention a few of the several projects we have underway, also in the framework of this COVID-19 pandemic, to show that the diplomacy of the order, the entire network, our ambassadors are very much alert and attentive to all the chances opened to fulfill the aims of the order. Thank you very much.
Thank you, Stefano, dear Stefano, for that extraordinary gallop through, so many of the important initiatives that our order is engaged in. We have all tremendous admiration and respect for what so many of the very hardworking diplomats of the order are up to, but we often feel at a distance, and this really gives us a tremendous introduction and help in understanding just how this channel is being used at this critical time. It's a perfect segue to introduce you to Ambassador Antonio Zanardi Landi. He's a great friend of the Global Fund for Forgotten People, and we often very enviously look at his beautiful photographs of not only the Palazzo Orsini that is in the process of being restored, but also of his visits to the Holy See and his conversations with the Holy Father. The mere fact that he appears to be out in the world a little bit makes me long for the days when we can be together. I know that the Holy Father will start his historic visit to Iraq at the end of this week, where I understand there are plans for him to visit Malteser International's major refugee return program in northern Iraq and the Nineveh Plains. Can you tell us a little more about your ongoing dialogue with the Holy Father and what his understanding of our efforts are?
Well, the dialogue with the Holy Father has been a surprise, in fact, for me. It happened during a very formal occasion, which is the presentation of the greeting for the new year, which happened a few days ago, 15 days ago. And usually is a rather formal occasion, but this time the Pope greeted me saying, say thanks to the Order of Malta for what they do in connection with the pandemics, which means that it was quite well briefed about the activities of the order. It was a pleasure for me and the good occasion to say, well, you're going to visit Iraq in a few days' time. Please remember that Malteser International and the order are managing a big operation in Karakosh in order to help the Hivites go back to their former homes and resettle down after being expulsed by ISIS. And seem to take good note of that, and probably will mention or say a word about this project. I don't dare to think that we'll receive the responsible people for the project. I do hope so, but I'm certainly not sure. But what is clear, has in mind what the order is doing also in Iraq and also in the Middle East. The order is happily very active and performing the real nature of his functions. Good afternoon to everybody and good morning. As I see that we have the honor of being followed by some friends, members of the order from the United States. Thank you very much for this wonderful occasion and for providing a wonderful picture of the global nature of the order. Seeing friends from Brazil to Europe to Angola is a great stimulus for us. I mean, it's a great thing. As you know, our embassy to the Holy See is not in the front line in drawing the order policies to tackle the health, social, and political problems created by the pandemic. These policies are put together at the Grand Majesty, by the Grand Chancellor, by Stefano Ronca, by the hospital, Grand Hospital as far as activities are concerned. We are simply trying to follow closely what the Holy Sees does on the field in establishing moral principles and international guidelines to reduce the huge damages created by the pandemic. We are trying to show every day how the principles which are informing the other activities are more close. In fact, they are the same to the ones coming to the teaching of the Holy See. We are doing that in many fields, very often in a rather indirect way. We are constantly keeping in touch with most of the cardinals living in Rome, with the head of dicasteries, in order to fine-tune our activities with the ones conducted by the Holy See. We are trying to be as cooperative, as close, as positive as we can with them, and show that the charisma of the order is strictly connected with the teachings of the Catholic Church. The interaction is particularly lively and frequent with the Secretariat of State, and Catherine is particularly accessible and ready to help. The pontifical councils, the one for culture, for human integral development, with the congregation of the religious, with the congregation of Oriental churches, with the pontifical congregation for ecumenism and interreligious dialogue. We are trying to sponsor, thanks to the help of some donors and our sponsors, every initiative is proposed to us. In general, obviously, they ask us to help in small initiatives, but with a very strong moral significance. For example, we have been helping financially a documentary which was called Nineveh in Iraq, talking about the Ninevites last 2 years ago. We have been sponsoring the Stand Together project in coordination with the Ground Hospital's office. We have been sponsoring a clinical rehabilitation project in Venezuela, working together with you, with the Global Fund for Forgotten People. We have been giving a little but significant amount of money to an educational project in Kisangani, in the Democratic Republic of Congo, and many other little projects which are enabling us and enabling the order to work together with entities of the Holy See or with European churches. We are organizing a lot of presentation of books, conferences, and all these sort of things, which, I mean, do not mean a lot in itself, but is a process which is positive and going on for years. We are trying to keep in touch with the ambassadors to the Holy See. We took them to visit the hospital of the Magliana, which is managed by the Italian Association of the Order. And we have been taking them to many places where the interaction between the Order, the Catholic Church, and Italy, because we are working in Italy, has been particularly lively and positive. Our activity in supporting now national pilgrimages, and we did so with Germany, with the Grand Priory of Bohemia, with the international pilgrimage, has been suspended due to the pandemic, but everybody knows that we are always ready to start again. And we are trying to support the activity in the field of other entities of the order. And the one you have been mentioning at the beginning in Iraq is the most clear example, trying to show to the Holy See and to the Secretariat of State what kind of good things entities of the order are performing. At the end of the day, and connecting with what Stefano Ronca said, today the subject, the main item of the 107th World Day of Migrant and Refugees has been announced, and it will be celebrated at the end of September. And the title chosen is Towards an Even Wider We, which is a fantastic theme given to the Pope, to all Christianity, but I think it comes very close to the core of our mission. I think that it will provide us a lot of good occasion to interact with the Holy See and to interact with our friends on the other side of the time. Last thing, as Stefano was mentioning, a wide range of activities is a small thing concerning a booklet. We are going to reprint the statutes of the infirmary, of the hospital of the order in Malta in the 18th century, which it happened to me to read for the first time a few weeks ago. And I've been really surprised to seeing how modern, how updated the order was almost 300 years ago, and how much, how closely to today they were operating in order to fight the pandemics. And I thought, together with the Grand Hospital, that to reprint it and distribute it everywhere, but mostly to the Holy See, would help to refocus the attention of our interlocutors on the first main, most important raison d'etre of the order, which is working in the health sector, helping the sick and trying to be as helpful as we can towards people who are suffering 300 years ago, 400 years ago, and today. Thank you very much, Lisa.
Thank you so much, Antonio. I'm so, I hope the rest of you are as inspired as I am. I knew that there was a remarkable amount of work that was being undertaken, but it's just, it makes us feel so close to the work as we're isolated and on our own, focused on local projects. To hear the remarkable work that still is being carried on is very valuable to all of us. I thank you. Before we open for questions in the last quarter of our time together, I am going to just ask the Grand Chancellor to give us a final comment, or to kind of put a wrapper on all we've heard today. Thank you, Grand Chancellor.
Lisa, thank you. Not to wrap up, but as there are quite a couple of ambassadors participating, I do not want to miss the occasion to thank them for the ongoing efforts they are undertaking to keep the diplomacy of the order alive in spite of the difficult circumstances. While a lot is going on the multinational scene, bilateral diplomacy has become a difficult job for our ambassadors, especially those who are not resident. And everywhere a certain tiredness is surfacing as the pandemic is dragging on. And I want to thank all of them for their efforts to carry on with their important mission.
Thank you very, very much. I will now open to questions. As you know, there's 4 or 5 pages of participants that I need to scroll through. So please feel free to unmute yourself and ask a question if we had missed you. I'm scrolling through right now to see if there is anyone who would like to pose a question to any of our panelists or all of our panelists. Oh, Benedicta, I think, is that your hand? Benedicta?
Antonio Maria Domeno. Yes, thank you very much. We were talking about ethics, and I'm working with ethics too, and I always get the question about the vaccines ethics because of the origin with cells. Is this any issue in the order? The cells of fetus in the COVID vaccine?
Benedicta, I think we have to be very precise. There are no cells.
No, they are. The testing is done on the cells.
What we're testing, yeah. The Congregation for Faith has issued a statement that the vaccines can be used without restrictions.
Yes, and is there any protest in this group? Because I see this protest in our Catholic Church in Sweden, for instance, that people don't want to get vaccinated because of these cells.
I think we as order follow the teaching and the statements of the Church and can trust that we are safe if we follow this path. If individuals have individual concerns, I do not want to challenge them. That's their matter, but we follow the teaching of the Church.
Thank you. There's another question from Antonio Maria de Mello.
Good afternoon. I'm calling from Angola, Luanda. The virus now is not a very big issue because now it's summer here in Angola. And the other thing is that most of the people are asymptomatic. So they have other disease and they create some anticorps that the virus doesn't come too strong. But the summer is going down. In March, the summer is off. And comes the season that is more cold, so the people are not very prepared to have this kind of virus. What I'm asking is there any program that I can vaccination program that I can present to the government and offered by the order or something like that? Or because what I know from the government, they are not very it's not very important for the government to buy the vaccines because there are other diseases. But I assume that in 2 or 3 months, the situation will be worse about the virus, and in that time could be late. So my answer is that can I study with the government any proposal to send to them about the vaccination?
Lisa, may I try to answer briefly? I think this would be beyond the capacity of the order to get directly involved in the logistics, purchasing and distribution of vaccines. But the only advice I can give is that the government should take contact with the World Health Organization to be included in the COVAX initiative for the distribution of vaccines.
And can we help the government to do this to the health organization, or is only...
I would suppose that Angola has an ambassador in Geneva accredited to the UN organizations, who is the person who should do the first contact. If you have a special, let's say, indication where the order could get involved, you can contact our ambassador in Geneva, Desi Pictet, directly. But I think in general, it would be the way would be that Angola takes contact through the health ministry or the ambassador with the World Health Organization.
Okay, I'll do this. Okay, thank you.
In general, in Africa, it's very difficult. it's an advantage that the population is very young. And we all know that younger people are less prone to severe developments during the illness. On the other hand, some African countries show a significant increase in mortality, which is not attributed to COVID directly because there are no tests. But the increase in mortality indicates that COVID is also a problem in many African countries.
Thank you. Did I see Fabrizio? Did you have a question? No. Teresa, did you wish to?
Yes.
Yes,
I would like to say that naturally, as order of Malta, we cannot import vaccines, but we can distribute with the government and other organizations. That's what we are doing. We are a post-specialized tool. There are many, but not all of them, to give the vaccines. And also we are working with an institute that makes research, and they produce vaccines, and we are working with them in a region to interview people and ask if they where they live, the kind of house they have, how many children, what they eat, to make a study of the way the virus is impacting the population. And the way it seems to me is that to give hands to others to grow, because the incidence is very big in Brazil.
Wonderful, wonderful. Thank you, Teresa. Is there do I see a Fabrizio?
Yes. Good afternoon, I'm Fabrizio Vinacci, ambassador in Peru. And in Peru, we were participating to the commission from the refugees from Venezuela. And before COVID, we were performing a good work jointly with Ministry of Foreign Affairs, Ministry of Health of Peru. Now, coming COVID, of course, everything has changed and everything has been postponed because some Venezuelans are coming back to their country. But the COVID in Peru now is in a very worse level because they have all the various different type of COVID. So we have problem of migrants, we have problem of COVID, and we have problem of all the little village in the Andes and completely abandoned. We have been requested from the Ministry of Health to help at least the pupils in the school in order to allow them not to go to the school, but to have the lesson or to have an help with vaccination, to restart with school activities.
No.
Now, I know, as the Grand Chancellor said, that we have not the possibility to organize the logistic on the vaccination or whatever it is. But in Peru, which is the country I know, we are trying in any way to help them to survive to this pandemic. Considering people, Peruvian people and Venezuelan people that we were taking care before COVID for migration. Now, my request is that any help we can give to Peru is welcome, because they are now in very, very bad situation, or maybe worse in all South America. Thank you.
Thank you very much for that perspective from the region and from Peru. I know we have just a few more minutes, and I'd invite any other ambassadors of the order who wish to perhaps give us a very short insight into their experience. You'll just have to speak up for me because I'm not able to scroll through fast enough if your hand is up. Okay. Well, I wish to thank everyone who's participated in this discussion today, and especially our panel, the Grand Chancellor, our Ambassador to Italy and Head of Foreign Affairs, and our Ambassador to the Holy See. We're privileged to have the leadership we have, and also the openness with which you are able to tell us about your work. It's a great honor for us all to be together in this sort of intimate conversation. I did notice we have one Fra of our order, Fra Gottfried, and I'd ask him to help us conclude our session today with a Pater Nostra that we can say together. Everyone's welcome to unmute to join in that. And I thank you on behalf of the Global Fund for Forgotten People, and I wish you all a blessed Lent and a joyous Easter when we reach that moment. Thank you very much.